Welcome to the premiere disc video, where you will learn how easy it is to sharpen the JAC 3435 scaler. We will review its intended use and the important parts of this instrument tip, as well as common problems to avoid in sharpening, and, most importantly, just how easy it is to use the disc sharpener for predictable sharpening results every time. All scalers are considered universal and designed with two cutting edges along the face of each working end. Both working ends of this instrument are created alike, but with reversed angles on each end to access buccal and lingual surfaces. The shank of the JAC 3435 scaler has a contra-angled bend so that the blade, shank, and handle are not in the same plane compared to a straight sickle scaler. When comparing the differences between a scaler and a curette, you will find that the scaler has a pointed tip and triangular back to the working end, whereby the curette displays a rounded toe and smooth rounded back to its working end. The JAC 3435 scaler is used to remove supragingival deposits on the proximal surfaces and all posterior teeth. The face of the blade is applied at 0 to 20 degrees and open to a 75 to 80 degree angle to the tooth surface. The instrument strokes are activated at the line angle with the tip toward the proximal surface. The stroke is completed on the proximal surface before moving to the adjacent tooth. The most efficient way to complete a scaling procedure on a selected section is to scale all proximal surfaces on the buccal aspect and then apply the opposite working end to complete the same process on the lingual side. Limitations when using a handheld stone include establishing precise angles and maintaining control, selecting the proper stone, increased chance of injury. Sharp instruments keep you at peak efficiency while minimizing physical stress. Your patients will appreciate an efficient procedure with greatest comfort to them. The Premier Disc Sharpener eliminates the need to remember which angles are required for each instrument design. The guesswork is eliminated because the settings are clearly marked on the disc wheel. It is easy to sterilize. The ceramic stones are ideal for maintaining instruments daily and require no lubrication before use. The disc indicates there are two different settings corresponding to the alternate blade angles on each working end. Rotate the wheel so that the 40-degree setting will line up with the indicator line. Tighten the screw. Place the 35 end on the front stone so the tip faces the wheel as the handle of the instrument is aligned parallel to the bold reference lines on the wheel. Then, simply move the instrument blade across the stone while keeping your wrist steady so the instrument remains aligned with the bold reference lines during the entire stroke. Flip the instrument to the 34 end. Place on the rear stone with the tip pointed towards the wheel and handle aligned with the bold reference lines. Repeat the same sharpening step. To sharpen the alternate edges, change the setting on the disc sharpener to 0 degrees. Position the toe facing the wheel. Notice the handle is now below the stone and aligned with the reference lines on the wheel. When in this position, it is easier to hold the instrument in your palm. Move the blade across the stone. Flip the instrument to the rear stone with the tip pointed towards the wheel and handle aligned with the bold reference lines. Repeat the same sharpening step. Finally, take a test stick and apply the sharpened cutting edge to the stick to check for bite, as this indicates a successfully sharpened instrument. Regardless of whether you are sharpening the JAC 3435 scaler or more complex designs, the disc gives you complete confidence you are sharpening each instrument correctly for predictable, efficient results in clinical use. Premier utilizes Smart Sharp technology, a proprietary process for well-defined edges that are easy to sharpen. Premier instruments are available in a wide variety of handles: Light Touch, Big Easy, and Big Easy Ultralight. Big Easy Ultralight scalers and curettes offer the ultimate in ergonomics and comfort. The lightweight, large 1/2-inch diameter handle weighs up to 30% less than other instruments. They are surprisingly light. The handle is an advanced technology polymer with medical-grade silicone grips to offer exceptional lightness and durability. Premier has introduced many innovations in the area of instrumentation. These include the novel Perio-wise color-coded probe, ideally suited for a quick screening or a full examination. Implant scalers made of graphite-reinforced resin have thin, sharp tips with well-defined edges to effectively remove calculus and plaque, but will not scratch implants. Since 1913, Premier has established itself as a world leader in dental instrumentation, utilizing time-proven procedures completed by skilled craftsmen, all in accordance with Premier's quality system. When you choose Premier, you are selecting over 100 years of experience in quality manufacturing. The family tradition is now in its 4th generation.